I want to welcome everyone to FCS at Home. Our session today is going to be presented by Dr. Carrie Ashurst, and her topic is making mental health a priority. So I hope that you will join us and learn something. Just as a reminder, a couple of housekeeping things. If you have questions, feel free to type them in the chat box if you're watching on Zoom, or in the comments if you're watching on Facebook Live. We do have moderators who are watching both, and we'll make sure that Dr. Ashurst has a chance to answer those questions. I think that her plan is to answer all the questions at the end, but feel free to type your questions in as we go along, and we'll keep a record of those. So at this point, I'm going to turn it over to Dr. Ashurst.
Good afternoon, everyone. I hope you're doing well, and thank you for joining. This is Dr. Carrie Ashurst, and I am a Senior Extension Specialist for Family and Relationship Development in the Family and Consumer Sciences Extension Unit at the University of Kentucky. So welcome. I am really glad you're able to join me today. And I want to thank Mindy and Sally and Maria up front for the work that they're going to be doing to help with chats and questions that you all may have along the way today, too. So we're going to get started. I know a lot of us are under a lot of stress right now, and we've been talking a lot about some of the physical concerns, physical health concerns we have revolving around COVID-19. And we hear a lot about mental health issues, right? We hear a lot about that being said in the media and even through our governor's daily press conferences, but we don't always know exactly what that means, what we can do about it, how we can actively participate in our own self-care and the care of others when it comes to our mental health. So that's what we're really going to focus on during this time today. So really just taking that time to prioritize the mental health pieces of our lives and learning more about what that means and how we can understand it for ourselves and for others. And we can also be helpful to others, of course, when we can recognize some of those warning signs, which we're going to cover today, and also looking at what mental health issues mean, knowing what to do when someone is suicidal, those initial steps that we can take to help someone who might be feeling suicidal, and then finally doing our part to reduce stigma. So that's what we're really going to be focusing on today. So really, what is mental health? We hear those words a lot. We don't always know exactly what they mean.
Carrie,
really, it refers to, yes.
We lost your screen.
Okay, are you back on now?
No, it says you're not sharing right now.
Okay, let me go back into it. Can you see it now?
Not yet.
Okay, sorry about that.
Do you want me to pull it up and share it, and you can just tell me what to advance?
You know what, that would be great, because if I got kicked out once, I might continue to get kicked out, Mindy.
Yeah, okay, go ahead and keep talking, I'll pull it up.
Yes, ma'am. Okay. So really, what is mental health? What does it mean when we say mental health? Truly, it focuses on your emotional, your psychological, and then also your social well-being in a nutshell. It affects how we think, feel, and act. It helps determine how we handle stress in our lives, how we make choices in our day-to-day lives, and even affects our ability to just simply get through the day. And so I'm on slide 5, Mindy.
Okay.
And so really, mental health can be influenced by a lot of factors, one of which is events that are happening in your life, things such as life experiences, chronic stress. We're all certainly going through chronic stress in some form or fashion right now in our lives, aren't we? Trauma that we've experienced in our lives that can come in many different forms. And then also our family history, addiction, mental health diagnoses that we've had amongst family members. And then finally, our biology can influence our mental health, our genetics and our brain chemistry. Okay, let's go to slide 6 there. So we're going to talk a little bit about mental health support today and what to do if you or someone that you know might be struggling, and some things that you can look for in the way of warning signs. But first and foremost, remembering that none of us are alone, even though it can feel like that when we're really struggling with mental health issues. There are support services and treatment options that are out there. And it can be difficult to find those. It can also be difficult to talk about those or to seek those supports initially. But when we do, that there is really truly hope for recovery. And that's one of the important pieces of anything we talk about with mental health, is remembering that it's not always easy to see a light at the end of the tunnel, if you will, but that it is there, that we can really find hope and move toward recovery. So some of the things that we want to talk about are changing in behavior or mood that might be early warning signs. And this can include a sudden increase or decrease in improvement or decline in your mood. We oftentimes think about, sudden downward mood spirals being a telltale sign of somebody having a mental health concern. But sometimes sudden increases in mood, improvements in mood, can also be a warning sign. And it's not always easy to tell the difference either between expected behaviors and warning signs. And I use the word expected instead of the word normal or normative for a reason, because expected means us as individuals. It means what we're experiencing ourselves and what is expected just for us, because no two people are alike. And also, unlike something like a physical health issue or disease, diabetes, cancer would be examples, there is no medical test that's out there that can accurately diagnose mental health conditions. Okay, Mindy, could you advance us to the warning signs? There you go, thank you. So we're just going to run through a few of these that are in bulleted form on the next couple of slides here for you to kind of think about some of those early warning signs to look at and be aware of. The first is excessive worry or fear. And of course, take that with a grain of salt, because I think a lot of us are experiencing some excessive worry or fear right now in our lives. Feeling extremely sad, confused thinking, extreme mood changes, which again can include highs or lows in our mood, drawn out feelings of irritability or anger, and drawn out being the key words there, because we all are going to experience some feelings of anger and irritability in our lives from time to time, but it's when it gets more drawn out over time that it can be more of a warning sign or concern. Avoiding people. And that can mean, in any form. That's in person, which of course we're sheltering in place right now, but even staying disconnected or isolating yourself online and other forms in your life. Thoughts of suicide, and then use or abuse of alcohol or drugs. You can go ahead and pull up let's see, I think there's 4 more bullets there on that particular slide. There we go. One more there, Mindy. And then moving on to some more warning signs on the next slide. Problems concentrating or learning. Changes in sleeping habits or feeling tired and having low energy. Changes in your eating habits, which can include an increase or a decrease, either one, in eating habits. Changes in sex drive, multiple physical ailments with no known cause, such as headaches, stomach aches, or other ongoing aches and pains. Inability to carry out your daily activities or handle daily stressors. And then difficulty perceiving reality, which in a nutshell means experiencing or sensing something that doesn't actually exist. So those are just some of the most common early warning signs in the literature, but again, remembering that at any point in time, any of us might experience some of these, and it doesn't necessarily mean we're having a mental health issue or that there is a concern about somebody around us. That, we all go through things in our lives that can cause us stress, that can cause us a lot of worry, can cause us times of feeling down and blue. And that it oftentimes comes back to the expected behavior in an individual, that if it's significantly or dramatically different behavior than what we usually see in a person, then that's when there's more of a reason to concern or start looking for some of those warning signs. So the next slide here focuses specifically on suicidal thoughts and some of the warning signs with suicidal thoughts. First and foremost, threats or someone making comments about killing themselves, someone increasing their alcohol or drug use, aggressive behavior, social withdrawal from friends, family, and community, and the things that they would typically be doing in their lives, dramatic mood swings in either direction, talking, writing, or thinking about death, and impulsive or reckless behavior. So those are the first set of warning signs. And then there's a second slide here that continues on with a few of these. The next one being giving away prized possessions, family history of suicide attempts or completed suicides, a mental health issue that has not received any kind of attention or treatment, and living with a chronic or terminal illness. So again, all of those are warning signs around suicide, but are not necessarily a telltale sign or, definitive proof that someone is suicidal or that it's imminent or that they have a mental health condition by any means. It's just things to look at that might be different from someone's expected behavior for themselves. And two that are not on those slides that can often be two of the biggest predictors of concerns around suicide are, number one, any previous attempts. When someone has had a previous attempt, they are more predisposed to another attempt in the future. It doesn't mean that they will. It just means that it's more of a warning sign. It's more of a concern. And then an organized plan, which means having a plan in place for how they will attempt suicide. And again, some important points to remember when it comes to the warning signs with mental health issues and with suicide in general are that talking about some of these things with someone does not necessarily mean that they have a mental illness or that they are suicidal. It just means that they are at increased risk, and it is important to take those warning signs very, very seriously. And then also, talking about suicide with someone does not increase the likelihood that they will attempt suicide. And I think that's an important point to be made. Sometimes it's very hard to talk about, isn't it? It's difficult to talk about a topic like suicide. And we think sometimes that we should not bring it up, or that we think we might plant the idea in someone's head. But truly, when you're talking with someone about suicide, you're not increasing their likelihood that they will attempt. In fact, you're helping a person to talk about it, and you could potentially help reduce the risk of a suicide attempt. And again, going along with it being very hard to talk about a topic like suicide, a lot of people often ask, well, what can I do? What if someone tells me that they have felt suicidal in the past, or that they might feel suicidal now? Sometimes just asking that question and saying, I'm here, and I may not be the expert, but I'm certainly here to listen non-judgmentally. I'm not going to place my values on you, and you can talk to me. And just being brave enough to ask the question, are you feeling suicidal? And if so, do you want to talk about it with me? And telling someone that you're not scared of it, that you're willing to listen and be there for them. Okay, Mindy, let's go to the slide that says May is National Mental Health Awareness Month. If you've got that next one there. I wanted to bring this up because nationally, May is National Mental Health Awareness Month every year in the United States. And right now, I think that's really important while we're sheltering at home to think about what we can do, both with May and all throughout the year. We can learn more about mental health issues, of course. We can educate ourselves. We can go to really good websites that are out there, such as the National Alliance on Mental Illness, to be able to learn really good research-based information about mental health issues. And the more that we can educate ourselves, the more that we can help others along the way. We can also help dispel the myths about mental health. We can learn the facts and make sure that we're not sharing false ideas about mental health. We can also learn more and educate ourselves to be able to see the person and not the illness, remembering that every person has their own story, and that when we can learn more about just their condition or their diagnosis, that we can really start to understand and feel deeper empathy toward a person. We can be better non-judgmental listeners for others. And we can also help people with finding the right resources for them individually, remembering that no two people are alike, even when they have the same mental health diagnosis. And then finally, and most importantly, remembering to treat everyone with kindness and dignity. We're all going through things, aren't we? And when someone has a mental health issue in the midst of all the added stressors we're going through right now in our world, it can be extremely difficult to even just get through the day. And remembering that everybody out there is dealing with something, treating people with kindness and dignity can really go a long way. Let's go to the next slide there. So the next slide talks about taking action, thinking about mental health issues that we have going on in our communities, in our society, how badly our mental health care systems are in crisis with lack of funding, lack of staff, lack of programs and resources. When we even think about Kentucky and where we live, we've got a lot of rural areas where there may not be access to a lot of resources, and may have to have people traveling long distances to be able to get to some of those resources and treatment centers. And so it might, as a result, seem a little bit out of reach for a lot of people. People can sometimes go years from the time that they start thinking that they're having a mental health concern before they're actually actively seeking treatment. Some people may never seek treatment at all. And some of that can have to do with access in their community, but also with health insurance and a lot of other things. But there's things we can do no matter where we live. We can help in many ways. We can push for legislation and policies. We can talk about it, being freely, honest and open with some of our conversations about it to be able to increase awareness and show that this problem cannot be ignored. And we can certainly lend our support to show that this cause is important, that it's just as important for us to talk about our mental health as a priority as it is to talk about our physical health. And one piece that I think is really important to always bring up when we talk about taking action is the next slide here, which is social media. Oftentimes we think about social media being a bad thing, and it certainly can be, but social media can be an amazingly positive thing when it comes to helping to talk about our mental health issues out here in our society, to share ways to reduce stigma, to help people get needed support and learn what supports are out there. And, using things like Facebook, Twitter, Instagram, and other social media platforms to be able to share factual information and to increase understanding, but also to uplift and empower people to get help, to remember that there is hope for recovery, and to be able to look at the possibilities that exist out there even for informal resources right at our fingertips on our computers through social media. We can even use hashtags such as Cure Stigma to be able to tag some of the posts that we put on social media to help people be able to find those more easily, or even to organize some of our own posts so that we can get back to those collectively when we're doing a program or a training or any kind of an awareness piece. So helping to reduce the stigma. A few things we want to talk about there. one of which is talking openly. We've discussed that several times today, but again, it's important to bring up over and over that we need to talk openly about what it's like, share our stories, share other people's stories, encourage other people to share their stories. Is absolutely worth it, even if it helps one other person out there, when we can share those stories and help to reduce some of that stigma. We can also educate ourselves. We can take those opportunities to really be able to find out more about, maybe it's a mental health diagnosis someone in our own family or friendships has, or maybe it's something that we have going on with us and we're not quite sure what it is that's going on. We can also be very conscious about the language that we use along the way. Remembering that language matters. It does really matter, and we're all bad about it at times. I know one of the things that I tend to do sometimes is say things like, oh, I've had such a crazy day, or, you know, it's been a crazy experience, or something like that. And, you know, thinking about offering alternatives to ourselves and to others, generally even in intervening when we hear other people make some of those comments in our society, to be able to look at how to not use those words as adjectives toward people, especially saying someone's crazy or someone's nuts, or, you know, some of the different words we have in our society. And really taking responsibility for ourselves, and when we can really be mindful, and, you know, we're going to still do it, and that's okay, you know, give ourselves the breaks, but remember when we say something to think about an alternative way we could have said it. And along with that too, calling out media. We might have the opportunity at times to be able to gently nudge the media and say, you know, a comment was helping to increase stigma instead of reducing stigma. And taking those opportunities, again, doing it in ways that are civil and kind, but seeing those windows of opportunity. And then encouraging equality between physical and mental health. I can't state this one enough. You know, that idea that it's okay to go and seek help when you have something wrong with you physically, but it's also okay to seek help when something is going on with your mental health, and that it's okay to talk about that, and it's okay to share that with others as well. When we see mental health as a disease, we think twice, right? We look at it differently. For example, we wouldn't make fun of someone who has heart disease or cancer. You know, it makes us think a little bit more about our comments, but it also helps us think a little bit more about ourselves as well. And, you know, not hiding ourselves in shame. When we are coping with a mental health issue in our own lives, sometimes we might defeat ourselves as well and say, well, I'm gonna be strong and I'm gonna get through this, and I'm not gonna do anything, I'm not gonna get help. But when we can really say it's okay to get help, it's okay to seek treatment or seek services, resources, go and talk to our primary care physician to get started on where else I might be able to go for the appropriate resources for myself. That we're helping to empower ourselves and say it's okay. It's okay that I'm feeling this way, and it's okay that I'm seeking help. And then we'll move to the next slide there, Mindy, about if you need help. And so like I just said, one of the best places to start at times, if you don't know where else to start, can simply be with your healthcare providers, your primary care physician, or a pediatrician for a child. You know, as somebody who's in your community already that you can go to first to be able to start some of that conversation and find out where else to go. Also learning about what resources are in your community and being able to find those for yourself and others. And even sometimes longer distances away if it's necessary. And, you know, thinking about people with pre-existing mental health conditions that should continue with their treatment and be aware of new or worsening symptoms. That, you know, if you've already got some pre-existing mental health issues going on, that you're taking care of yourself, that you're taking medication if medication is prescribed to you, or that you're doing the things to be able to care for yourself along the way. Don't stop those things, even in the midst of some of what we're dealing with right now with sheltering in place. You know, exercise, nutrition, some of those things can all be helpful, getting enough sleep, and making sure that we're still really following a routine and putting our mental health as a priority and doing those things we need to do. And then looking at different resources that are out there if you need help as well. The disaster distress helpline, for example, that exists, 1-800-985-5990, or even being able to text Talk With Us to 66746. That those are resources that exist out there where you can get immediate assistance. Also, the National Domestic Violence Hotline, 1-800-799-7233, to be able to call or be able to chat or text with if you don't feel safe being able to make a phone call. Those resources exist and can get you help quickly. And then if you need help or someone you know needs help with feeling suicidal, the National Suicide Prevention Lifeline. And I would even encourage you to put these phone numbers in your phone so that you have them available for yourself and others to be able to use along the way. Have them right at your fingertips for sharing with someone who might need them that you come across or talk with. The Suicide Prevention Lifeline is 1-800-273-8255. And I've also got the websites for both their overall website for the Suicide Prevention Lifeline and for their chat program that they have on that slide. And it's important to remember, too, that when you call a number like the Suicide Prevention Line, that you may be put on hold, you may have some pauses, you may have some waits, and to not give up or not let someone that you're helping to make that phone call give up. They're going to be transferring you to someone who's as close to you in proximity as they can get. They're going to be trying to put you with somebody who's local if at all possible. And so there are going to be some moments where you're on hold, but then they're going to be able to try to get you to someone who's as close to you as possible to get those needed resources and supports. And then if in doubt about anything, or if something is an immediate emergency or extreme emergency, simply calling 911. Even something like thinking someone may be having a panic attack. If you're not absolutely certain, or they're not absolutely certain that it's a panic attack they're having, it could possibly be a heart attack, because heart attack symptoms and panic attack symptoms can look very similar. So if in doubt or if unsure, call 911. We're going to move now into some slides that focus specifically on some things that I pulled together in response to this infectious disease outbreak. And so, Mindy, if you could bring up, if you don't already have it up, stress during an infectious disease outbreak can include slide number 19 there. We're going to move into talking about some things that are very, very real to us all right now. So some of this stress can include fear and worry about our own health and the health of loved ones, changes in our sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health issues, worsening of mental health issues, and an increased use of alcohol, tobacco, or other drugs. So how do we cope with some of these stresses we're all under right now? We can take breaks, and that might sound simple or even trivial, but sometimes it matters more than anything. Just taking a break. It might mean taking a break from watching, reading, or listening to the news. It might also mean taking a break from your children for a few minutes and having a little bit of me time to take a shower or read a chapter or two of a book. Whatever seems to be the things that work for you, think about what works for you when it comes to taking a break and remembering to do those things, because we all need them right now. Taking time to unwind. What do you enjoy? Maybe you enjoy reading a book. Maybe you enjoy getting out and walking through your neighborhood. Whatever those things are that help you to unwind, continuing those whenever possible, knowing that there's limits right now, but there are still a lot of great things that we can do. And then connecting with others. Even though we're sheltering in place right now, there are so many wonderful resources at our fingertips, like the ones we're using right now for this session with Facebook and Zoom, to be able to still connect with people. utilizing those resources to be able to feel connected can also feel very good and can help us keep going. Reaching out to others as well, helping other people who might not be connected as well. Maybe it's just a daily text or a daily phone call or something to be able to ask them if they're okay. Is there anything we can do to help them feel better in terms of talking through something? You know, the things that we might have limits on right now, but that we can still try to do to help other people connect and stay connected. And then the next slide there talks about ways to support our children and our teens during an infectious disease outbreak. Again, just taking some of that time to be able to talk with children about COVID-19 and their fears, their concerns, answering the questions and sharing the facts in a way that a child or a teen can understand, keeping it developmentally appropriate. For example, with young children, trying to not give a whole lot of detail or medical terminology or making the conversation too long, just making it simple and fact-based. Reassuring them that they're safe as well can be very, very important for any age of child. Letting them know it's okay if they feel upset or scared. Sharing with them how you deal with your own stresses. What are the good coping mechanisms that you use in your own life to help them learn coping mechanisms that will take them throughout their lives in all kinds of ways, not just dealing with what we're dealing with right now with this infectious disease outbreak. And then helping them sometimes to also take those breaks from the news and the media and getting away from social media and getting those breaks when they need to, but also not overdoing it with the numbers and the deaths and some of the information that we're being inundated with, helping them to get up and limit some of their exposure to the coverage of those events. They may misinterpret some of what they hear, and they can even feel frightened with some of the numbers and the things that they're hearing and seeing that they may not fully understand, especially if they're younger. Keeping up with regular routines, and I almost have to laugh when I read that one because I have an 8-year-old myself, and keeping up with regular routines has been pretty difficult lately with being at home for 3+ weeks at this point and starting non-traditional instruction through school and everything else we've had going on, trying to move to a remote work system for a lot of us, that routines have kind of been thrown out the door at times. But children can feel very comforted by routines and schedules, and remembering that when we can help to keep them in a routine, we also help them to feel more calm and deal with a lot of the stresses that they're under a lot better. Creating a schedule too for learning activities, chores, various different things as well can be helpful. And then being a role model, and this is often easier said than done, right? But when we're role modeling that we're taking good breaks, getting sleep, exercise, eating well, staying connected through those sources we have these days, but we're really showing that we can all get through this, that we can cope with some of the biggest stresses in our lives, and we can make it through, and showing our kids the best and most productive ways to make it through. I want to go ahead and stop now for a few minutes, Maria and Sally, and see if we've had any questions coming in on the chat.
This is not a question. There's just a comment that there is a good song named after the National Suicide Prevention Lifeline. And the song was Logic Foot, yes. So, and that is in the chat box there.
Huh, okay. You cut out just a little bit. Can you say that again, Sally?
Sure. So in the comment box, there is a song that is named after the National Suicide Prevention Lifeline, and it was to help increase the awareness about suicide. And the song is a number, 1-800-273-8255.
Oh, gotcha. Okay. Yeah, and 8255 on your dial pad spells out talk, just in case anybody's interested in that. And I mentioned also the chat line, and of course the website was on there on a few slides ago, but I think it's worth mentioning again. There are a lot of people in some of our younger generations especially, who may not feel comfortable with a phone call, that may not feel, you know, the intimacy of being one-on-one on a phone conversation. It may increase their stress rather than decreasing it. That chat line is now available 24 hours a day for that very reason, to be able to go and chat with someone and get immediate help, but not necessarily need to be on the phone with somebody. Any other questions or comments that have been coming through?
Not here on Zoom, so if anybody does have any, if they'll chat those in, I'll get those to Carrie.
Okay, yeah. And as anybody is typing any of those in, I'll have Mindy go ahead and go to the next slide there that shows the graphic. And this is a graphic that came off of the website that the governor has been mentioning at 5 o'clock each day on his press conferences, his live Facebook sessions. That's Kentucky COVID-19. And it's a simple graphic, but I really like it because it just sort of gets at some of the basics about staying informed with reliable sources. There's a lot of unreliable sources out there. And this one's got some good resources on there, as well as the website in general, not just the graphic. Again, preserving some of your daily routines, taking a break, as we mentioned before, maintaining a healthy diet. And our UK Family and Consumer Sciences Facebook page has a lot of really good resources and information on that topic. Taking advantage of outdoor activities when and where we can, getting out and taking a walk, walking a dog, walking with a child, you know, just getting some of that fresh air and enjoying some of the spring sunshine here in Kentucky. And then not isolating, staying connected with others in all the different appropriate ways that we can right now. So I think that slide really gets at some of the biggies of what we've talked about today in a nice little graphic form. And again, that's Kentucky COVID-19's website, and the website is listed at the bottom of that slide there if you want to jot it down to use it. And there's some other good mental health resources on that website as well. And I think they will be adding to it with links to some other good websites. And I mentioned before also the National Alliance on Mental Illness has some excellent resources where you know you're getting good, reputable information as well. Has
Carrie,
anything else come through on chat?
Yes. Carrie, there is a question about, would this be available for agents to have and put in their May newsletter?
Oh, absolutely, yes. Yes, Mindy is recording this today for one thing, so the stream will be available later for anybody who wants to listen to it again or was not able to participate today. And then for our agents that are on this web session today, there are a number of information releases on our internal page and some other resources too that you can get to on some of these very topics as well. And I can send things to people that would like to get a hold of those anytime.
Carrie, just another comment that they would like to see more Facebook posts and media on this topic.
Excellent. Very good. Yes, and if people have ideas or suggestions on specific topics, I would love to receive those as well.
All right, I think that we are ready to wrap up the session for today. We thank you for joining us, and I especially want to thank Dr. Carrie Ashurst for her time and her expertise on this topic. Please remember that if you have questions, please contact your local extension office. They are all working and are eager to serve you in all the ways that they do. They're just not open to foot traffic right now, but of course you can call or email or even find them on social media, and that's a great way to get in touch with them. So thank you for joining us today, and we hope to see you back again next week. Our session will be on Tuesday.
Family and Consumer Sciences Extension at the University of Kentucky. Our agents share research knowledge with individuals, families, and communities to improve quality of life. Building strong families, building Kentucky. It starts with us.